Welcome, everyone, to this informative video about ureteral fistulas. A ureteral fistula is an abnormal connection between the ureter, the tube that carries urine from the kidney to the bladder, and another organ or surface. This can lead to a variety of complications and significantly impact a person's quality of life. In this video, we'll delve into the causes, symptoms, diagnosis, and treatment options available for this condition. Let's begin by exploring the common causes of ureteral fistulas. Iatrogenic injury, meaning injury caused by a medical procedure, is the leading cause. Surgeries like hysterectomies, cesarean sections, bowel resections, and kidney or ureteral procedures can inadvertently damage the ureter. Other causes include trauma, such as penetrating injuries to the abdomen or pelvis. Less frequently, ureteral fistulas can arise from inflammatory bowel disease like Crohn's disease, advanced malignancies of the bladder, uterus, or rectum, and radiation therapy to the pelvic region. Rarely, congenital abnormalities may also predispose individuals to fistula formation. To understand the effects of a ureteral fistula, we need to understand the underlying pathophysiology. Normally, the ureter efficiently transports urine to the bladder. When a fistula forms, urine leaks from the ureter into adjacent structures. This abnormal urine leakage can irritate and damage surrounding tissues. Depending on the location of the fistula, urine may leak into the vagina, a vesicovaginal fistula, the skin, ureterocutaneous fistula, the intestines, ureteroenteric fistula, or other nearby organs. This leakage can cause a variety of symptoms and increase the risk of infection, inflammation, and even kidney damage due to obstruction. While precise epidemiological data is limited, ureteral fistulas are considered relatively rare. Their occurrence is closely linked to the frequency of the surgical procedures that can cause them. For example, the incidence of ureteral injury during hysterectomy varies, but is generally low. The overall incidence of ureteral fistulas after pelvic surgery is also relatively low, but important to consider in individuals undergoing these procedures. The risk may be elevated in individuals with pre-existing inflammatory conditions, malignancies, or previous radiation therapy in the pelvic region. The signs and symptoms of a ureteral fistula can vary depending on the location and size of the fistula. Common symptoms include persistent urinary leakage from the vagina, skin, or surgical wound. Patients may also experience abdominal or flank pain, fever, urinary tract infections, and skin irritation or breakdown around the fistula site. Some individuals may present with hematuria or blood in the urine, or pneumaturia, which is the passage of air in the urine. In some cases, the fistula may be asymptomatic and discovered incidentally during imaging studies performed for other reasons. The specific symptoms will depend on where the urine is leaking, so presentation can vary quite a bit. Diagnosing a ureteral fistula typically involves a combination of imaging studies and clinical evaluation. A thorough medical history and physical exam are crucial. Common diagnostic tools include cystoscopy, which involves inserting a camera into the bladder to visualize the ureteral orifices, intravenous pyelography, or IVP, which uses X-rays and contrast dye to visualize the urinary tract, retrograde pyelography, where dye is injected directly into the ureter, CT scans with contrast, and MRI scans. Dye studies can also be used to identify the site of urine leakage. The choice of diagnostic method depends on the suspected location of the fistula and the individual patient's circumstances. Ureteral fistulas can be classified based on their location. Ureterovaginal fistulas involve a connection between the ureter and the vagina. Ureterocutaneous fistulas connect the ureter to the skin, often at a surgical site. Ureteroenteric fistulas connect the ureter to the intestines. Finally, uretero-uterine fistulas, though rare, involve a connection between the ureter and the uterus. Understanding the specific type of fistula is critical for planning the appropriate treatment approach. Treatment for a ureteral fistula aims to close the abnormal connection and restore normal urinary tract function. Treatment options vary depending on the size, location, and cause of the fistula, as well as the patient's overall health. Small fistulas may heal spontaneously with conservative management, including bladder drainage via a catheter and antibiotics to prevent infection. Larger or more complex fistulas often require surgical repair. Surgical options include ureteral reimplantation, where the ureter is reconnected to the bladder, ureterostomy, where the healthy ends of the ureter are rejoined, and bowel interposition, where a segment of bowel is used to bridge the gap between the ureter and the bladder. Minimally invasive techniques, such as laparoscopic or robotic surgery, may be used in some cases. An important aspect of management involves addressing any underlying conditions, such as infection or inflammation, that may be contributing to the fistula. Preventing ureteral fistulas primarily focuses on meticulous surgical technique during procedures that carry a risk of ureteral injury. This includes careful dissection, precise suturing, and identification of ureteral landmarks. Intraoperative techniques, such as the use of ureteral stents or indocyanine green dye to visualize the ureters, can help minimize the risk of injury. When possible, less invasive surgical approaches should be considered. Postoperative monitoring for signs of urinary leakage is also crucial for early detection and intervention. The prognosis for patients with ureteral fistulas depends on several factors, including the size and location of the fistula, the underlying cause, and the patient's overall health. With timely and appropriate treatment, most patients can achieve successful closure of the fistula and restoration of normal urinary tract function. However, complications such as recurrent fistulas, ureteral strictures, or kidney damage can occur. Recent research focuses on improving surgical techniques, developing new biomaterials for fistula repair, and exploring less invasive approaches for treatment. Furthermore, research is being conducted on identifying and mitigating risk factors for ureteral injury during surgery. This research ultimately aims to improve outcomes and quality of life for individuals affected by ureteral fistulas. Thank you for watching.